All right, well, let's begin then today. Welcome, everyone. As we know, our standard open enrollment is over. Yes, it is over. However, we do have a lot of opportunity with qualified life events. Just want to make sure that everybody's aware of the qualified life events, using them, and that way we can make sure that we are still entering in business. Plenty of opportunity that's still out there, still able to get with people, talk with them, and really find opportunities to enroll. So you should be looking for those opportunities. Your team should be looking for those opportunities because they are out there. One of the biggest questions that I get regularly is a change of income. And if I'm talking to someone, and let's just say that they have a Humana policy or an Aetna policy, for example, if that's the case, can I switch them to Blue Cross? And yes, there is opportunity to do that. If your client does have a significant change in income, something that is going to change them from a standard plan to A, B, or C variation of a policy, well, in that situation, they will get an opportunity to enroll. And when you do that, you can do a selection of a different plan, and you can make sure that you are enrolling them in Florida Blue. Also, keep in mind that if any person in the family has a qualified life event, that does give the entire family an SEP or a qualified life event as well. So that is something that you should be working with. You should be identifying those folks, especially those individuals that you are doing service work for. For example, if Mr. Falco comes into my office and saying, "Oh, woe is me, the marketplace screwed up my policy. I had a Humana policy. I can't afford it anymore. What can I do?" Ask some generalized questions and see if you can identify a life event. See if that client who's walked in could potentially have had a change in income. And if that change of income is valid, then you can enroll that member. Also, be advised that you are going to have some members that you can work with within the system. And what I mean by that is that if you do have someone that does have a change in income, however, they don't want to apply all of that subsidy, they are able to get that subsidy or disclose a lower income, therefore getting an SEP or a variant to change their policy, but not apply all of said subsidy. So, for example, if we were doing a quote for someone and they come in and the difference was that they did lose some income, they maybe lost one of their jobs, but that income variation wasn't enough to move them to the standard variation or give them a plan change. Well, that income can be adjusted a little bit more, but not apply all of said subsidy. Because when you get into the application, you can adjust the subsidy used, so that way they don't have a negative impact with the IRS at the end of the year, because no one wants to have a negative impact with the IRS. So as you're looking at that, make sure that you're utilizing that. Make sure that you're trying to identify these reasons. Also, as in past conversations that we've had, less is more many a times. You don't have to dig in. You're not, Inspector Gadget. You're not an accountant. You can ask a generalized question and say, for example, if you're talking with client Gary comes into your office and you're talking to him and say, well, unfortunately, Gary, unless you lost your coverage, I'm not able to do an enrollment for you. So let me ask you, Gary, did you have a loss of coverage? If Gary says yes, then I move on and do an enrollment. I don't need to go through any deeper conversation. He told me he lost his coverage. Again, you are not Inspector Gadget, so therefore you can go ahead and do that enrollment. What you have to realize is that when you call the marketplace, which many of you may or may not do, would not advise it, but you have to sometimes. And when you do call that marketplace, the goal of the marketplace is to get someone enrolled. They will do things that we would not do. They would act in a manner that we don't necessarily approve or follow. They don't follow the rules all the time. That doesn't mean that we're not going to do that. But what it means is that you have to understand the rules that you're working within, ask the correct questions. Did you lose coverage? Are you going to lose coverage? These are very generalized questions. If they say yes, be done with it. You don't need a copy of that policy. You don't need to get any more information about it. It's on attestation of application. If the member tells you that, be done, do your enrollment. So understand that, then making sure that you can still write this business. Has anyone had any problems accessing any qualified life events, doing life changes, adding children? Have you had any hurdles with that anyone needs any guidance with? It is moving pretty smoothly, and I just want to make sure that everybody's comfortable with it. Question coming in from Holly. What is the minimum amount of time someone would need to be enrolled in a short-term policy in order to get a marketplace plan for loss of coverage? Come on, Hallie. There's no minimum amount. They have to be losing coverage. 30 days. That's the shortest amount that you can write a short-term medical policy. So if you write a 30-day policy because the person does not have a loss, so if you use my example of the client that walked into my office, if they say absolutely not, I did not lose coverage, well then I'm going to have to install a short-term medical product for you, and therefore when that product is terminating, we can write the new product. And that would be that qualified health plan at that point in time. There is no question about time frames. Remember what I just said. So even if you were in a situation where we have a client that comes into the office, well, let me ask you a question to everyone. Let's say you offer them the short-term medical product as a solution to give them a loss of coverage and they can't afford it. Ask the question again. Holly, have you lost coverage? Well, no. They have to get it. Remember, you have to read between the lines here, everybody. So if they can't afford it, they can't utilize it, they're not going to go through that. I'm going to show you guys a solution today that you can access through our US Able products that you should be talking about as we get to that in a little bit. If you have a client that loses coverage from a temp policy, would her husband, who has his own individual policy, be eligible for an SCP? Let me repeat what I said earlier. If one person in the family has an SCP, then everyone in the family has an SCP. So if I had a husband and wife that is going through a policy and they're looking at it and we are trying to identify some sort of SCP, and we don't have to write a short-term medical product for both family members. If you write it just for one family member and that family member has a loss, then the whole family does. Think about it as if your client has a child who is no longer eligible for Medicaid, or a client whose child lost coverage, then the whole family gets an SCP. I put an application in during open enrollment and submitted the application through the Florida Blue website. Therefore, didn't create a marketplace username and password. How do I go into the marketplace to create a life event? Well, what you're going to have to do is you're going to have to go into healthcare.gov and you're going to have to create an account. Very simple. We've been doing this, so it's very straightforward. Go to log in. You're going to go to create an account as you see on the screen in front of you, and then you will answer the questions. Once you create the account, you will be brought to a page that is going to say to start your 2015 application. And there will be highlighted in blue something that says find my application. It's a hyperlink and it's going to say find my application. At that point, take note of this, everyone. You will then enter in the eligibility ID that we have from the original application, and then that will bring in the policy. If it does not bring in the policy, there may be a problem with the way that you created the account. Could be the spelling of the name. It could be the email address or other identifying factors, and you may need to call the marketplace, unfortunately. But that's only if there's multiple accounts. It does work rather seamlessly. Once you find and identify that plan, then you can go into plans and programs. Find that plan and you will do a life event. Very straightforward. Justin is asking, loss of short term is considered loss of minimum essential coverage? No, it's not. It is not considered loss of minimum essential coverage, but the question on the application is, are you losing coverage? We're not trying to, work the system in here, but the question is very clear. Did you lose coverage, or are you going to be losing coverage? And that's how you would access that. Short-term medical is not in any way, shape, or form minimal essential coverage. They would still be um, eligible for a penalty through the IRS. They would still have that. But in many situations, as you know, the goal of the government and the marketplace is not to allow people to go uninsured. They want people to be insured. Therefore, we want to assist in that process because we'd like people to be insured too. So because of that, we can utilize this. And what you have to understand, everybody, is something very clear. And I've talked about this several times with our agents at A&B, and I need everyone to also realize this as well. Right now, we are given, some would call a gift, some would give some flexibility, depending on how you're looking at it, on how we can enroll members. And if you think about how it was when Medicare Advantage first came out in 2006, you basically could kind of run around and do a lot of the things that you wanted to do and get things accomplished, even though they may not be perfectly black and white, but on the borderline of gray. It's not that you're trying to do a disservice or you're doing anything shady or incorrect. What you're doing is you're trying to insure your member and you're utilizing the rules that have been handed to you. Well, what we're going to have happen here very soon, within the next couple of years, is the flexibility is going to go away. And everything that we do in the Affordable Care Act is going to look very, very similar to what you're used to in CMS. So if you are dealing with Medicare clients and you know that you can't just send in an application saying it's an SCP on a Medicare Advantage application, that is going to happen with us here on the Affordable Care Act. So take advantage while you can and know that at some time or another, it is going to go away. Because our goal is to have as many clients as possible. I mean, I know that that's our goal here at A&B. We want to help people, of course. And as we're going through that, what you have to understand is you must gather as many clients that are in your corner, that work with you, that have you as their go-to now, because later on, you might not have the same opportunities. If these people are in your book of business and they know when it comes time to renewal that you're the person they're going to talk to, and you know that you are going to be the one that's going to handle that for them, then it's a normal progression. Cross-selling that business, selling other products is also going to be an opportunity, but also maintaining that book of business in the form of renewals is where you're going to really start to see it move. Referrals as well. All of these people, you do a good job, so scoop that business up now if you can. Question coming in from Holly. Is Blue Cross honoring the writing agent for those members that receive a July 1st renewal letter and call Blue Cross Blue Shield and they change their plan? They're supposed to be, yes. So if they have a renewal letter in July because their Blue Options policy is having a rate increase and they change their policy with a Blue agent, are they honoring the AOR? They're supposed to be. What is? Hold on. Maybe I don't understand your question, Holly. What? No, are you talking about, Holly? Are you talking about your clients? Maybe I should just unmute you. What's your question, Holly? Because I don't understand. You're unmuted, Holly. What is that smell? Somebody cooking something? Are you eating? Ugh. Okay, you don't have a phone line. You have but it's on there on a, okay, never mind. So if there's somebody else's client and not yours and you write them, you're not going to get the AOR. You're not going to get paid. So if Holly writes one of Mark Carbellano's Blue Cross underwritten policies, you're not going to be the agent. If that's what you mean, that's the rule. If it's your client, you'll remain as the AOR, but they are going to honor the original AOR, the original writing agent from those policies. Hopefully that clears it up. Moving on, Christine, good morning. Will Florida Blue be adding back mid-range deductibles for 2016? I don't think that that's even even going to apply. Mid-range deductibles, those types of things, under qualified health plans with minimum essential coverage, and the way the actuarial tables work, I don't think you're going to see them. You're going to see your $5,000 deductibles. We have some lower deductibles now that are available to you on the Gold HSA plans and different things like that. But due to the way the actuarial value of the plan has to be designed, that is not really going to be on the table. And you're not going to really see that from any of the carriers. So I don't think that that's something that you need to really focus on, but think about it this way, is that it's all dependent upon what the other carriers do as well. Because when we talk about our second lowest cost silver plan, when we talk about what's going to be released coming up, you're going to be very excited, and those mid-range deductibles shouldn't really apply too much. Now, if you're talking about folks that are looking at a plan now that may be like a $5,000 deductible, and that's just too much, or they're looking at an HSA plan or something like that, and it's the deductibles just aren't there. The lower deductibles just aren't available. So what can you do in order to offset that? Well, what you can do in order to offset that is, first of all, hopefully know your login, but is to make sure that you're selling ancillary products. So, Christine, great question. Perfect lead in for me. As we talked about last week and the week before, we spent some time. We talked a little bit about the US Able products. And what you're able to do is look at some of those products as an opportunity for you to actually, to lower their out-of-pocket expenses by these ancillary products in the form of accident coverage or critical illness. And this is really going to play into two different areas that I wanted to cover today. And the first is going to be exactly what Christine is talking about. So how do I lower my financial exposure for my client? They're looking at a higher deductible plan. They're looking at something that is typically not what they're accustomed to. Well, we can gravitate towards a plan like our plans that have a $5,000 deductible, and then that plan would also have doctor visit copays, prescription copays, and other opportunities there. But what we can also do is, let me just pull this up for you really quick, is we can offset those things, and we can offset those things by adding in that accident plan, for example. Because let's face it, what statistically most of the people who ever end up in the hospital or the emergency room are doing so because they're having an accident, not because they're having a heart attack. Little Johnny is actually going to the hospital because he broke his arm. He's not having appendicitis as much. So when we're looking at those options, when we're looking at that, we have to make sure that we're putting that into the conversation right in the beginning. So that way you're not going to a post-sale, going back and telling someone, oh, well, most of my clients do this, or, I wanted to make sure I gave you a call so that way we can get this taken care of for you and round out that book afterwards. Do it at time of sale. You've already identified, what their cost basis is going to be, what their plan variation is going to be as well. And that's where you can add this accident plan or the critical illness to a policy to offset those costs. So for example, if I'm looking at it, if I add a whopping $18 to a plan, that's not going to necessarily make or break someone from a cost perspective, but being able to show them offsetting of their deductible, where you could pay their deductible or out-of-pocket expenses in the most likelihood of an accident, which statistically is going to happen. And all those individuals that tell you, oh, I haven't had an accident in 8 years, you could tell them very clearly, well, you're due. But utilizing this product will help you offset those higher deductibles. And what it also does is give you another income stream. And if for some reason your client doesn't decide to stay with you during open enrollment, well, they can still keep this policy, because this policy will work and will be portable with them from whatever company they may be with. And trust me, it is utilized with every policy. Remember, these benefits are paid directly to the member, and they are paid as cash benefits. Also, making sure that if you're talking about this product, what is free on all of our plans? What's free on all of our plans, if you don't know already, is our checkup. And in the event that your client gets a checkup, and when they get that checkup, they don't pay for it, they're going to make either $75 or $60 for that visit. Now, if that's a single individual, you're paying up 4 months of this policy right there. So the policy pays for itself. And in addition to that, if they end up getting admitted to the hospital, $1,500. Each day that they're in the hospital, and an extra $340 a day. If you have to take an ambulance, $600. If you need other major diagnostic exams, MRIs, CAT scans, $200. Well, these numbers are in line with their copays that are on their policies. And if it's not in line with the copays on their policies, well, then that's cash benefits to them. Or that's money that applies to the deductible. Remember, identifying with our clients what they need cash. Our clients don't have the nest egg in order for paying medical bills or putting food on their table in the event that there is an accident, if someone can't go to work. Additionally, critical illness coverage, as we talked about, is also something that you want to start adding into the equation of your conversation. Low-cost products, high return, low service. That's right, I said low service. Can you imagine writing a product that someone doesn't call you about service on until they get diagnosed with a critical illness, as opposed to every time they go to the dentist? So these products are going to be very interesting for everyone. You should absolutely be talking about these. If you haven't done your appointment paperwork already with Miss DeFalco, get that over to her, because that way you can start offering these products, adding an additional income stream to the revenue of your agency. You would be foolish if you're not doing it. You've already got the people on the phone. You're already talking about that. And remember, these benefits, if you put in the reoccurring benefit to it, is going to pay twice. For example, you have a cancer diagnosis, you get 100% of the face value. So for example, if this was a $30,000 policy, or in this case, it's a $15,000 policy, if I got diagnosed with cancer, I would receive $15,000. As I'm going through chemotherapy treatments or other treatment, I, for heaven's sake, get a stroke, then I'm going to get another $15,000. And statistics say if you get diagnosed with cancer and you start going through cancer treatment, the cancer treatment, as many of you may know, is killing you. And while that's killing you, it could cause you to have a heart attack. It weakens your system. It could cause you to have a stroke. And because of that, they can get paid twice on this policy. Heaven forbid, I hope they don't, but they could. Because the statistics don't lie. If you're going through chemotherapy treatments, your body is getting broken down. The medicine is killing the cancer, but it also could be hurting the body. Yes, there's underwriting on these policies. We are going to be having an underwriting training that we're going to be doing, and you guys will all be invited to that as well. It's probably going to be early next week or the latter part of this week. So let's also address something that someone said before. Well, short-term medical is not a minimum essential coverage. Correct. Well, what happens if I get somebody on the phone and they're 60 years old and they can't afford a short-term medical product? $300 a month. They just can't afford it. Sorry, can't afford it. So what can you do for that client? Well, we need a solution. Now, depending on their health status, what you want to look at is you want to look at building them a policy, and building them a policy that may be the best thing that they can get outside of open enrollment. And of course, that would be a short-term medical solution, but let's figure they can't afford it. So what do you do? Well, a combination of an accident plan, a hospital indemnity plan, and a critical illness does solve some of those solutions and some of those problems for your clients. Because if you come down to our hospital indemnity product, it is not a replacement for major medical coverage. But if you look at the costs that are associated here, it's not that much money. And for your client to be able to get $500 a day for each day that they're in the hospital for $53 a month, that's not so bad. That's cash benefits that they can get paid to them. They can use that money to negotiate with the hospital, to negotiate with the doctors for better pricing, so they don't lose house or home. They can make a settlement. They will not receive the Blue Cross Blue Shield negotiated price, so don't even ask now, because that's not how it works. That's not how any of this works. But, for example, if I was looking to put a policy together, someone who was in good health, over 400% of the federal poverty level, for example, so they're not going to be subsidy eligible. What are their solutions? They don't want to pay the $300 or $400 a month for their short term. They don't want to pay $1,500 a month for their qualified medical plan. Well, then maybe what you do is give them an offering of a hospital indemnity plan with critical illness and an accident coverage. And for this particular demonstration, you can see an accident plan of a whopping $18. Ugh. A critical illness plan of a whopping $14. And a hospital indemnity of $32. So what is the cost there? Not that much, and they have protection. They can go into the doctor, they can get their checkup and receive $75 back for getting their checkup. They have an accident, end up in the ER, they've got money to cover their bills. They end up getting diagnosed with cancer, they've got some money to cover their bills. And guess what? At that point in time, they will figure out some way to enroll in a qualified health plan. So it is not a replacement, but it is an alternative to you selling a short-term medical. It is an alternative to an Obamacare style plan. Many people say, I don't want anything to do with that governmental you know what. So you can build them a policy that avoids all of this and still gives them a level of protection that they need. And these products are available for anyone to be sold under the age of 65, but they can keep these policies long past and for the lifetime of the policy. At age 75, some of the benefits will reduce based on the plan. But your member can buy an accident plan at 58 or 60 or 64, for example, and have that policy. They can keep it for their life. And how many people are seniors that end up with a broken hip that they end up with out-of-pocket expenses that could be satisfied by this accident plan? So a great way for you to give someone an alternative that isn't killing their pocketbook. Does that make sense for everyone? These are available year-round. There is no SEP required. These are products that we've talked about rounding out your book. So as you're doing customer service, oh, Mr. Jones, I see that you have a problem with your ACA plan. You need to pay. By the way, most of my clients have a cancer or critical illness policy, and I see that you do not. I can make sure that I get that taken care of for you, where I provide you $15,000 worth of cash benefits if you get diagnosed with cancer. And that could actually be up to 30. How should we get that started for you today? The assumptive close and go right to it. Anytime you're doing customer service, you should be talking about these products or utilizing that opportunity of conversation for some sort of conversation that's going to bring revenue into your agency. And that's going to be in the form of a product, or even better yet, how many of us are asking for referrals on every single conversation? You're not. Maybe you are. God bless. Well, I know many of you are, because I've seen the numbers, and I know that many of you have done a tremendous job. And right now, what I'd like to do is just, say bravo. Many of you are on this call today. I think we've got 3 or 4 agencies that have qualified for leadership, that are going to the leadership conference. And how do you get there? Well, you get there by working hard, by talking to everybody that you can, and offering these products and having a good understanding of how it works. But just in case you didn't know, it's all based on points. it's not based on the policy that's sold. Sort of, it is, but not really. I mean, they have this convoluted way of calculating points based on the products that you sell. And maybe you don't know this, but the dental coverage has the same weight as a bronze plan. Hurts me to even say that. However, when you think about it, if you're selling someone a bronze program and some dental, now you've doubled the points, and now you're competing with the big boys and gals that are doing huge volume because you're increasing your point value. So if you want to get a bonus check, if you want to hit bonuses, if you want to be on the leaderboard, if you want to end up going to the Boca Beach Club, last year it was at the Ritz, I think it was, or something like that, I can't remember. This year at the Boca Beach Club, look forward to seeing you guys down there. That's going to start on Wednesday. And you could be there. And all you have to do is sell these products in addition to what you're currently doing. By offering the ancillary products, those are points. The dental, those are points. And these equate to big bonus checks. A couple of our agents in our organization have received bonus checks upwards of $12,000 to $15,000. Last year, we've had four major top agents, one receiving over $25,000 just in first quarter bonuses from Florida Blue, direct from Florida Blue. So and I want to congratulate your team members because I don't know everybody's names that's within your organization, but I know that you guys have team members that made this leaderboard and are making bonuses, and congratulations and definitely great job, and there's definitely more to come. So to make things a little bit easier for us, Blue Cross is actually doing a good job this year and getting things ready, okay? And when they're getting things ready, well, Bill's asking a question, is the leadership conference open to MAAs? Absolutely. We have MAAs there every year. I don't know if Chuck is on the call today, but Chuck Hurst gets there every year. I know that Pauline is going to be there this year. I know that she's on the call with us today. So we do have representation from the MAAs. It's just all about production, all about making sure you're making it happen. Well, you can work as hard as you want, but if you don't have a good product and you don't have a good network, well, then it doesn't matter how hard you work. You're not going to sell that much, right? Well, Florida Blue is giving us some gifts this year, and I need everybody to be aware of these gifts that they're giving us because it looks like we're going to have a really good enrollment season yet again. And what does that mean? Well, if those of you that are paying attention to agent service bulletins, A&B Insurance has a blog. I don't know if you guys are following our blog or not, but Florida Hospitals and Florida Blue have come to an agreement. Bravo, that's fantastic. So what we are going to be able to do, and there was a little political bantering going back and forth about that. And we do know that they are going to be in network after June. It's fantastic. HCA hospitals also been added to the Blue Select network, and that is a variable based on area. They haven't all been added yet, but a lot of the major markets already have them added. That's mainly in the Orlando, Tampa Bay area, where they are also in Pasco County, excuse me. There are some that have been added down in South Florida. However, Sarasota has yet to be added, and they're still working through some of those details. These are gifts. These are great things. Blue Cross is working on the network. They're getting everyone excited about it, and they are doing it for us. Additionally, new products coming out. Over 10 counties, we're going to have probably the best product and the best price product in Miami. Some of you may or may not heard Preferred Medical down in Miami having some problems. That opens up about 125,000 ACA members for us to go after. And with some of the exciting products that are going to be released, some of the costs that you're going to see, you should be very excited about it. And if you don't speak Spanish now, it would be a good time. There's going to be plenty of opportunity when we build out our new program with the new networks. It should be very exciting for everybody because Blue Cross is going to help us. If we were think about how it was the first year, those of you that were with us the first year, were we the only player in a select number of counties. Now, if you can imagine, not only will be the only player in some counties, but Florida Blue, who consistently and has not really ever been the least expensive policy, the goal in 10 counties, 10 major counties. I'm talking about Tampa Bay area. I'm talking about Miami. I'm talking about Orlando, where you will have the opportunity to have the lowest cost product or possibly a few dollars from Molina. Molina being the big player down in South Florida. So, great stuff. Lots of exciting things going on. Lots of opportunity. Any questions? All right. Lastly, I just want to remind everyone that if you have questions regarding commissions, definitely funnel them through Mr. Falco. Gigi hasn't seen a lot of commission inquiries from everyone, so it does make us a little bit nervous that either we're not looking or we're not watching them close enough. I would definitely advise looking very closely at them and making sure that you're identifying any issues or anything that you've got going on so we can work with you for resolution. Going to be very important for that. All right. So no other questions? I think I got everybody here. You have a Medicare question. Can I unmute you? Sure. What do you got? Chris, what you got?
Hey, buddy.
Morning.
Morning. Having an issue with the Medicare supplement. For some reason, it seems like the Florida Blue system is not recognizing when people are turning 65.
Correct. Yep.
Right. Okay, so I don't know if you guys have experienced that issue, but
yeah, absolutely. We addressed it a couple times though. Here's the problem. It's broken. So I wish I had a better answer for you. So IST for someone who's turning 65 doesn't work. The fix is supposed to go in in July. This problem came up in about November, December when the new rates were loaded. There was some technical issue. Who knows? Way over my pay grade, apparently. So in order to enroll an under 65, turning 65 individual, on a Medicare supplement, you will have to drop it to paper and send that in a blue envelope since it's a supplement. It's terrible. It's this, but they do, and they have committed that it will be fixed in July.
Okay.
Yeah. So pull the rate sheets out. Because even the quoting tool is not working. If you just need to get the pricing, what you can do is you can quote them at 66. 65 and a half to get the price there, or just use the rate sheets, making sure that you're monitoring the area factor that they're living in to make sure that you're quoting them the right price. Yeah, it's a pain in the you-know-what. I apologize for it. I've been screaming about it on the top of the table saying, hey, we really need to get this done. But unfortunately, it was just not high on the priority list for Florida Blue. So I'm sorry. Good question, though. Any other questions, Chris? You good?
Yes, sir. Thank you.
All right, no problem. Anybody else have any other questions? Let me just review some of the questions came through, making sure that I addressed all of them. Hey, Gig, has everybody gotten their information over to you for US Able products? Anyone that was interested, or? Okay. Not very many. Yeah, if anybody wants it, let's just do it now because we're going to do training and underwriting training for A and B agents. So I'm going to have one of the head underwriters from US Able come in and do a conference with us. I'm going to invite all of you and all of your team members to come. Space is going to be limited on that, but you want to have the appointment paperwork started when you're when you're going to do that. So that way it's not you're going to forget about everything that you learn in your training at that point. All right. Well, again, next week you guys all get a break from my big mouth, so everybody can take a deep breath. Yes, I know. I'm hearing clapping here from our people. Thank you. I'll remember that. But what you can do next week, just do your thing. I'm going to see many of you at the leadership conference. Definitely excited to meet some of you that I've never met before. And be able to talk a little bit. It's going to be a lot of exciting things released next week as well. So I'll be able to share some of that with you the following week. So should be some good stuff. Keep your eyes on the news, everybody. There's some interesting stuff going on with Aetna, Cigna, and Humana. Looking like that there's going to be some very big announcements over the next few days. Some companies possibly going out of business, and some companies possibly merging. So keep your eye on the ball there, and we'll keep everybody up to speed on what's going on with that. Oh, Chris has got another question. 1 second before we go. Go ahead, Chris.
Hey, sorry,
Nope, you're
sorry
good.
about that. Hey, one more thing on the Medicare side of things. When I read the Medicare supplement, for some reason, I'm going on IST, I'm doing everything through the computer. They're not giving me credit as the agent of record. I'm trying to say this the best way I can, be, plain and simple, but they're not giving me credit as being the agent. I'm having to call in like 3 and 4 times and ask them to go back over to the Medicare department and make sure I'm the agent of record so I can get paid.
I would
So,
bring that to Gigi, Chris, after our call, because if you completed your certification and you got all that stuff done, it should be pretty seamless. So you shouldn't have to be calling for that. But why don't you, after our call, let's give Gig a ring, and that way maybe she can give you some guidance on that. And if not, we can report it to the area manager, and the area manager can see if there's some sort of system issue. A lot of the times that has to do with certification tying back to you. It's almost like the Affordable Care Act getting a Z code on a policy. And Chris, that's a really good point. Everybody, don't assume that because you wrote the policy, because you've got your AOR or your NPN number in the application on the marketplace, that you're the agent of record. Because if you call Blue Cross, you don't see it in search accounts, you don't see the policy. I would definitely call Blue Cross and make sure, because the marketplace many times passes over the application with no agent of record on it, no NPN. I know it sounds silly, but they don't. And if that happens, you'll never get paid unless you identify it. The other problem that I believe the fix is going in with Blue Cross over the next week or two is going to be that when you change the AOR, it's not triggering that new commission to be paid. So you really got to keep your eye on it. I mean, it's a constant battle here in our offices, and that due to our volume. So I know it's a problem for you guys, but it's just a smaller segment that you have to really watch and look at. This week. Okay, so Gig is telling me check next week because the fix is supposed to go in for anybody else with ACA problems. Not yours, Chris. Yours is a little different. But any ACA problems for check next week because the fix is supposed to go in this weekend. I thought it was next weekend. All right. So everybody, I want to thank you for your time. Enjoy your week off next week. Thank you again for all of your hard work. Any questions that anybody has, let us know, and then get that information over to Mr. Falco for US Able, and then we'll invite everybody to the underwriting training as soon as that's set up. So look forward to that as well. Thanks everybody for their time. Have a great day. Have a good weekend. Bye-bye.